Irritable bowel syndrome, IBS. Irritable bowel syndrome, IBS, is a common condition that affects the digestive system. Irritable bowel syndrome, IBS, is a group of symptoms that occur together. It includes repeated pain in your abdomen and changes in your bowel movements, which may be diarrhea, constipation, or both. With IBS, you have these symptoms without any visible signs of damage or disease in your digestive tract. It causes symptoms like stomach cramps, bloating, diarrhea and constipation. These tend to come and go over time, and can last for days, weeks or months at a time. It's usually a lifelong problem. It can be very frustrating to live with and can have a big impact on your everyday life. There's no cure, but diet changes and medicines can often help control the symptoms. The exact cause is unknown. It's been linked to things like food passing through your gut too quickly or too slowly. Further, you may have oversensitive nerves in your gut, stress and a family history of IBS. IBS is a mix of belly discomfort or pain and trouble with bowel habits. It is either going more or less often than normal, diarrhea or constipation, or having a different kind of stool, thin, hard, or soft and liquid. Doctors used to call IBS with other names including IBS colitis, mucus colitis, spastic colon, nervous colon, spastic bowel. There are 4 types of the condition: IBS with constipation, IBS-C, IBS with diarrhea, IBS-D. Mixed IBS, IBS-M, alternates between constipation and diarrhea. Unsubtyped IBS, IBS-U, for people who don't fit into the above types. IBS isn't life-threatening, and it doesn't make you more likely to get other colon conditions, such as ulcerative colitis, Crohn's disease, or colon cancer. But it can be a long-lasting problem that changes how you live your life. People with IBS may miss work or school more often, and they may feel less able to take part in daily activities. Some people may need to change their work setting, shifting to working at home, changing hours, or even not working at all. IBS symptoms. People with IBS have symptoms that can include diarrhea, often described as violent episodes of diarrhea. Constipation alternating with diarrhea. Belly pains or cramps, usually in the lower half of the belly, that get worse after meals and feel better after a bowel movement. A lot of gas or bloating. Harder or looser stools than normal, pellets or flat ribbon stools. A belly that sticks out, mucus in your poop, feeling like you still need to poop after you just did. Food intolerance, tiredness, anxiety, depression, heartburn and indigestion, headaches, needing to pee a lot. Other causes. Other things may cause these symptoms sometimes. If it's IBS, you'll likely have these symptoms weekly for 3 months, or less often for at least 6 months. Women with IBS may have more symptoms during their period. Some people also have urinary symptoms or sexual problems. Stress can make symptoms worse. Serious symptoms include rectal bleeding. It could just be a side effect from your irritable bowel syndrome constipation, caused by a tear in your anus. The bleeding also might be caused by a hemorrhoid. But if you have a large amount of blood in your stool, or if the bleeding just won't go away, you should get medical attention as soon as possible. Weight loss. If you find you're losing weight for no reason, it's time to get it checked out. Fever, vomiting, and anemia. If you have one or more, or think you do, you should call your doctor. When to see a doctor. See your doctor if you have a persistent change in bowel habits or other signs or symptoms of IBS. They may indicate a more serious condition, such as colon cancer. More serious signs and symptoms include weight loss, diarrhea at night, rectal bleeding, iron deficiency anemia, unexplained vomiting, difficulty swallowing. Persistent pain that isn't relieved by passing gas or a bowel movement. Causes of IBS. The precise cause of IBS isn't known. Factors that appear to play a role include 1. Muscle contractions in the intestine. The walls of the intestines are lined with layers of muscle that contract as they move food through your digestive tract. Contractions that are stronger and last longer than normal can cause gas, bloating and diarrhea. Weak intestinal contractions can slow food passage and lead to hard, dry stools. 2. Nervous system. Abnormalities in the nerves in your digestive system may cause you to experience greater than normal discomfort when your abdomen stretches from gas or stool. Poorly coordinated signals between the brain and the intestines. They can cause your body to overreact to changes that normally occur in the digestive process, resulting in pain, diarrhea or constipation. 3. Severe infection. IBS can develop after a severe bout of diarrhea, gastroenteritis, caused by bacteria or a virus. IBS might also be associated with a surplus of bacteria in the intestines, bacterial overgrowth. 4. Early life stress. People exposed to stressful events, especially in childhood, tend to have more symptoms of IBS. 5. Changes in gut microbes. Examples include changes in bacteria, fungi and viruses, which normally reside in the intestines and play a key role in health. Research indicates that the microbes in people with IBS might differ from those in healthy people. Triggers. Symptoms of IBS can be triggered by 1. Food. The role of food allergy or intolerance in IBS isn't fully understood. A true food allergy rarely causes IBS. But many people have worse IBS symptoms when they eat or drink certain foods or beverages. They include wheat, dairy products, citrus fruits, beans, cabbage, milk and carbonated drinks. 2. Stress. Most people with IBS experience worse or more frequent signs and symptoms during periods of increased stress. But while stress may aggravate symptoms, it doesn't cause them. Risk factors of IBS. Many people have occasional signs and symptoms of IBS, but you're more likely to have the syndrome if you 1. Are young. IBS occurs more frequently in people under age 50. 2. If you are a female. In the United States, IBS is more common among women. Estrogen therapy before or after menopause also is a risk factor for IBS. 3. Have a family history of IBS. Genes may play a role, as may shared factors in a family's environment or a combination of genes and environment. 4. Have anxiety, depression or other mental health issues. A history of sexual, physical or emotional abuse also might be a risk factor. Complications of IBS. 1. Chronic constipation or diarrhea can cause hemorrhoids. In addition, IBS is associated with 2. Poor quality of life. Many people with moderate to severe IBS report poor quality of life. Research indicates that people with IBS miss 3 times as many days from work as do those without bowel symptoms. 3. Mood disorders. Experiencing the signs and symptoms of IBS can lead to depression or anxiety. Depression and anxiety also can make IBS worse. How is IBS diagnosed? If you've been having uncomfortable GI symptoms, see your doctor. The first step in diagnosing IBS is a medical history and a physical exam. Your doctor will ask you about your symptoms. 1. Do you have pain related to bowel movements? Do you notice a change in how often you have a bowel movement? Has there been a change in how your poop looks? 4. How often do you have symptoms? 5. When did your symptoms start? 6. What medicines do you take? Have you been sick or had a stressful event in your life recently? Depending on your symptoms, you may need other tests to confirm a diagnosis. Other tests. Blood tests, stool samples and x-rays can help rule out other diseases that mimic IBS. Will I need a colonoscopy? Depending on your symptoms, medical history and other factors, your doctor may recommend a flexible sigmoidoscopy or colonoscopy to examine your colon in more detail. These 2 outpatient procedures are similar. The difference is that a sigmoidoscopy examines just the lower half of the colon. A colonoscopy examines the entire colon. A flexible sigmoidoscopy can help evaluate bowel disorders, rectal bleeding or polyps. Your doctor will insert a sigmoidoscope, a long, thin, flexible instrument, into the rectum. Advance the sigmoidoscope to the colon. View the lining of the rectum and lower part of the colon. Here's what you can expect during a colonoscopy. Your doctor will insert the colonoscope through the rectum. Advance the scope and examine the entire colon. Remove small amounts of tissue for a biopsy, if necessary. Identify and remove small growths called polyps, if necessary. Often, doctors can make an accurate diagnosis and even deliver treatment using a colonoscopy. A colonoscopy is a much less invasive procedure compared to an abdominal operation. Do I need to see a gastroenterologist? If you have IBS symptoms, first talk to your primary care physician. Your doctor may refer you to a gastroenterologist. A gastroenterologist is a doctor who specializes in diagnosing and treating diseases of the digestive system, including IBS, colorectal, colon, cancer, liver disease, swallowing and esophageal disorders, pancreas disorders. Treatment of IBS. Treatment of IBS focuses on relieving symptoms so that you can live as normally as possible. Mild signs and symptoms can often be controlled by managing stress and by making changes in your diet and lifestyle. Try to avoid foods that trigger your symptoms, eat high-fiber foods, drink plenty of fluids, exercise regularly, get enough sleep. Your doctor might suggest that you eliminate from your diet high-gas foods. If you experience bloating or gas, you might avoid items such as carbonated and alcoholic beverages and certain foods that may lead to increased gas. Gluten. Research shows that some people with IBS report improvement in diarrhea symptoms if they stop eating gluten, wheat, barley and rye, even if they don't have celiac disease. FODMAPs. Some people are sensitive to certain carbohydrates such as fructose, fructans, lactose and others. They are known as FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides and polyols. FODMAPs. FODMAPs are found in certain grains, vegetables, fruits and dairy products. A dietitian can help you with these diet changes. If your problems are moderate or severe, your doctor might suggest counseling, especially if you have depression or if stress tends to worsen your symptoms. In addition, based on your symptoms, your doctor might suggest medications such as fiber supplements. Taking a supplement such as psyllium, Metamucil, with fluids may help control constipation. Laxatives. If fiber doesn't help constipation, your doctor may recommend over-the-counter laxatives. It includes magnesium hydroxide oral, Phillips milk of magnesia, or polyethylene glycol, Miralax. Antidiarrheal medications. Over-the-counter medications, such as loperamide, Imodium AD, can help control diarrhea. Your doctor might also prescribe a bile acid binder, such as cholestyramine, Prevolite, Colestipol, Colestid, or Colacevolin, Welchol. Bile acid binders can cause bloating. Anticholinergic medications. Medications such as dicyclomine, Bentyl, can help relieve painful bowel spasms. They are sometimes prescribed for people who have bouts of diarrhea. These medications are generally safe but can cause constipation, dry mouth and blurred vision. Tricyclic antidepressants. This type of medication can help relieve depression as well as inhibit the activity of neurons that control the intestines to help reduce pain. If you have diarrhea and abdominal pain without depression, your doctor may suggest a lower than normal dose of imipramine, dizipramine or nortriptyline. Side effects, which might be reduced if you take the medication at bedtime, can include drowsiness, blurred vision, dizziness and dry mouth. SSRI antidepressants, selective serotonin reuptake inhibitor, SSRI, antidepressants. They include fluoxetine, Prozac, Serafem, or paroxetine, Paxil, and may help if you are depressed and have pain and constipation. Pain medications, pregabalin, Lyrica, or gabapentin, Neurontin, might ease severe pain or bloating. Medications specifically for IBS. Medications approved for certain people with IBS include Allosetron, Loternex. Allosetron is designed to relax the colon and slow the movement of waste through the lower bowel. Allosetron can be prescribed only by doctors enrolled in a special program. It is intended for severe cases of diarrhea predominant IBS in women who haven't responded to other treatments, and isn't approved for use by men. It has been linked to rare but important side effects, so it should only be considered when other treatments aren't successful. Elexadoline, Viberzi. Elexadoline can ease diarrhea by reducing muscle contractions and fluid secretion in the intestine. It increases the muscle tone in the rectum. Side effects can include nausea, abdominal pain and mild constipation. L-oxatoline has also been associated with pancreatitis, which can be serious and more common in certain individuals. Rifaximin, Xifaxan. This antibiotic can decrease bacterial overgrowth and diarrhea. Lubiprostone. Lubiprostone, Amitiza. Lubiprostone can increase fluid secretion in your small intestine to help with the passage of stoolie. It's approved for women who have I.B.S. with constipation, and is generally prescribed only for women with severe symptoms that haven't responded to other treatments. Linaclotide, Linzess. Linaclotide also can increase fluid secretion in your small intestine to help you pass stool. Linaclotide can cause diarrhea, but taking the medication 30 to 60 minutes before eating might help. Potential future treatments. Researchers are investigating new treatments for I.B.S., such as fecal microbiota transplantation, FMT. Considered investigational at this time, FMT restores healthy intestinal bacteria by placing another person's processed stool into the colon of a person affected by I.B.S. Clinical trials to study fecal transplants are currently underway. Diet, lifestyle and medicines. There's no single diet or medicine that works for everyone with I.B.S. But there are lots of things that can help if you have been diagnosed with it. General tips to relieve irritable bowel syndrome, I.B.S., symptoms. Cook homemade meals using fresh ingredients when you can. Keep a diary of what you eat and any symptoms you get. Try to avoid things that trigger your I.B.S. Try to find ways to relax. Get plenty of exercise. Try probiotics for a month to see if they help. Do not delay or skip meals. Do not eat too quickly. Do not eat lots of fatty, spicy or processed foods. Do not eat more than 3 portions of fresh fruit a day. A portion is 80 grams. Do not drink more than 3 cups of tea or coffee a day. Do not drink lots of alcohol or fizzy drinks. How to ease bloating, cramps and farting. Eat oats, such as porridge, regularly. Eat up to 1 tablespoon of linseeds, whole or ground, a day. Avoid foods that are hard to digest, like cabbage, broccoli, cauliflower, Brussels sprouts, beans, onions and dried fruit. Avoid products containing a sweetener called sorbitol. Pharmacist. Ask a pharmacist about medicines that can help, like Buscopan or peppermint oil. How to reduce diarrhea. Cut down on high-fiber foods like whole grain foods, such as brown bread and brown rice, nuts and seeds. Again, avoid products containing a sweetener called sorbitol. Ask a pharmacist about medicines that can help, like Imodium, loperamide. How to relieve constipation. Drink plenty of water to help make your poo softer. Increase how much soluble fiber you eat. Good foods include oats, pulses, carrots, peeled potatoes and linseeds, whole or ground. Ask a pharmacist about medicines that can help, laxatives, like Fibogel or Normacol. Seeing a dietitian for irritable bowel syndrome, I.B.S. A GP may refer you to a dietitian if general diet tips for I.B.S., such as avoiding foods that trigger your symptoms, are not helping. They can suggest other changes you can make to your diet to ease your symptoms. Low FODMAP diet. A dietitian may recommend a diet called a low FODMAP diet. This involves avoiding foods that are not easily broken down by the gut, such as some types of fruit and vegetables, milk, wheat products. Psychological therapies for I.B.S. If you have had I.B.S. for a long time and other treatments are not helping, a GP may refer you for a talking therapy, such as cognitive behavioral therapy, CBT. This can help if stress or anxiety is triggering your symptoms. It can also help you cope with your condition better. You can also refer yourself directly to a psychological therapies service. These offer psychological therapies like CBT for common mental health problems like stress, anxiety and depression.